Hi guys, so you can see here that I'm in the hospital and I just wanted to record a video update about what's been going on. So I haven't gotten to record anything in the past few weeks because I've been feeling so sick, and you can see from my thumbnail, kind of guess what's going on. So for the past 3 weeks since New Year, I've been having symptoms that I just thought was from a viral infection. I started out with having nausea and vomiting, chills, aches, just feeling a lot of headache, pain in the back of my head and in my neck. And I'm kind of used to that because, I've been having symptoms from the skull-based tumor that I have. So I figured it was just inflammation from having the viral infection, because sometimes that can cause more pain. And so I just kept pushing through and tried to get through the day, but it was getting harder and harder to work and to function. Just staring at a computer screen or looking at my phone just made everything so much worse. And I just couldn't concentrate. I had like brain fog. I was sleeping all day. And then I knew that I was getting my infusion soon, so I waited to see if I could just get labs done at the same time and just investigate what was going on. I made an appointment with my primary care doctor. So on Wednesday last week, I went for my infusion and it looked like all of the labs were normal. So I'm like, okay, it's not from that. And then I talked to my doctor and she's like, okay, it's like you got to go into the emergency because it could be, the mass in my skull that's growing and causing my symptoms. So of course I went to the ACC, which is the Advanced Care Center for Kaiser. They did the MRI and it showed that the mass grew by about 30% since the last scan, which was December 13th. And if you guys watched my last video, you saw that I had a scan update and everything was shrinking, everything was going away, except for this one growing tumor that's at the base of my skull. So it's been there for about, I think 2019 was when I first had it, and the first signs of it was when I got out of the hospital. I was in the hospital for 5 days due to the complications from my treatments. And when I got out of the hospital, my tongue started to get weak on the right side and it was deviating off to the right. And I couldn't chew and I couldn't eat, and it was really scary. And so that's when they first found the tumor in my clivus, which is at the bone where the base of the skull is. And then I got it radiated with gamma knife and it made the symptoms go away. I mean, it got better, but my tongue function was still not normal. And then a year later, it started to act up again. And this was when actually all of my lung tumors and everything else was shrinking. And again, this one was growing. So then they radiated it again. And it kind of helped a little bit, I guess. It stabilized and I lost more of my function in my tongue. And after that, it just kind of like very slowly grew. And over the years, it's gone from about 1 centimeter to 3 centimeters in the last scan. So now in the most recent scan, which is only a little bit over a month from the last one, it grew by about 30 to 40%, which is really rapid especially for my type of cancer, which is supposed to be really slow growing. So this was not expected at all. Yeah, like I was really shocked because I just had really great results, and now I'm being told that I need emergency surgery to remove this thing. Yeah, like it was a little bit of a hard pill to swallow because I was doing so well. So yes, not gonna lie, lots of sobbing and not really happy with the news. But since then, I've really thought about it, and I do think that the timing for all of this is perfect. I had my femur surgeries about 6 months ago, and that was hard. That was really, really difficult, and it was very painful to not be able to walk and just be bedbound. So I've had 6 months to recover, and I built up my strength again, and now I feel like it's all planned for this last one to go because everything else is going. So this tumor doesn't know who it's messing with, okay? So it's gonna come out and everything's gonna be fine. Not gonna have any side effects or permanent damage from this, okay? At least that's what I'm praying for. And I know that God is with me and he's gonna protect me, and he's gotten me this far, and I really don't think that it's my time to go yet. So yeah, I'm here in the hospital. My surgery is planned for Thursday, and I have these couple of days just to get pre-op testing done, whatever they need to evaluate me for. My voice is hoarse because my right side vocal cord is completely paralyzed, and I also have some swallowing problems. My vision was blurry, and I was starting to lose a little bit of balance. I had a lot of increased pressure in my brain. So I'm on steroids right now, which is really helping with the symptoms, which is why I'm kind of normal and I can actually record this video. But before that, yeah, it was not good. So the surgery is going to entail them doing an open craniotomy where they're going to cut like a C shape around like the back of my ear. So they're going to shave a little bit of hair. They're going to go through there and then access the brain stem that way and remove the tumor, and hopefully they won't damage any nerves, because there's a lot of nerves running in that area, and there's a possibility that I could be worse. You know, I could lose my hearing, I could lose more tongue function, I could develop swallowing problems, or have my vocal cords completely paralyzed. So there's a lot at risk, and of course risk for infections and leakage of CSF fluid and all of that. So it's pretty scary. I've never had any type of brain surgery, so this is definitely going to be a first. I don't know how recovery will be, but I'll be in the ICU for about 2 days, they said, and then after that they'll transfer me over to the regular floors, and I'll probably be there for between 3 to 7 days depending on how I do. The really big key takeaway that for me for this was, I mean, I kind of just went to bed one night thinking, wow, like what if I don't wake up tomorrow, or if I don't wake up from surgery? What's going to happen? And it just really made me appreciate everything that I have. My husband, my kids, my family, my friends, everybody at church, my friends online, other cancer survivors sending me so much encouragement, and I just feel so grateful, you know, to be alive and to be in a place where I can actually get the surgery, because I know so many cancer patients from other countries and, you know, maybe not have the greatest access to care, and here I am just really privileged to have all this, and I'm just thankful to God for giving me the strength and the will to live and to continue my journey so that I can get through this. I just really think that He prepared the way for me, and I know He goes before me, and I don't have anything to fear. So I just wanted to record this and let you all know how I'm doing, and I'll make a video update about after the surgery, depending on how I feel. So yeah, so thanks for listening. I will talk to you soon.